Dr. Stacey Snider. I'm one of 5 physicians here in Stratford, and our site is called Avon Family Medicine Center, and all 5 of us are adjunct professors with the department, and we're one of the newest full-time sites to train residents. And so we are just in our 2nd year with Western, and we've had 1 full-time resident through his 1st year. He's in our 2 now, and we've just got our 2nd resident, and it's been a fantastic experience. All 5 of us were very excited to get back into teaching, and we've had kind of clerks and med students and residents come, but not on a full-time basis, and so this is great.
My name is Philippe Stewart. I'm a 2nd year resident PGY2 in family medicine through Western. I was the first resident out here in Stratford. I came through the year that the program started. As far as what it's been like to be a resident here in Stratford, so far it's been a pretty amazing experience. My opportunities here have been pretty staggering and exceeded what I thought they would be. Stratford has a population of about 32,000 people, but has a hospital that could easily service double that. We're very fortunate here in Stratford because we have access to the vast majority of specialists, and as far as services go, we have tons of them, and it's been pretty impressive. The medical community is fairly small as far as the size of the hospital goes, which means you actually get to know all of the doctors personally, which is really nice when you're dealing with specialists, because having trained in Alberta, it was a lot different in the big hospitals because they just don't tend to, you don't get to know the specialists on the same level, and you would never ever stop a specialist, in the middle of the hallway and talk about patient X, which I do on a regular basis here in Stratford. I can consult with them over lunch pretty much any time. Everybody gets along great, and the medical community is great in that aspect, and I think it works a lot better for patient care as well. As far as the clinic where I work goes, it's been very, very nice. It's a newly developed clinic. I work with 5 of the doctors that run the clinic here, and each one of them has different interests, which makes it very nice to get some diversity in what I do and learn how to do things differently. And each one of them is a fantastic practitioner, so I gotta say, to date it's been really, really good. Currently I'm going through my 2nd rotation here at the clinic. Starting to pick up a lot more responsibility. 2nd year is pretty intense. Busy most of the time, lots of call, lots of work, and just the administrative stuff is can be a little overwhelming at first, but they're definitely getting into a groove, and the support staff is fantastic here as far as making sure that everything goes off without a hitch and keeps you going.
We CARMS matched for the first time last year, and it's been great ever since. We really enjoy having residents here. We all love to teach. We all have our other special interests in medicine, and we plan to continue that on for a long, long time.
Stratford offers a really unique residency program, so it has all of the amenities of a urban site, but we're considered a more rural regional site. So how that's an advantage is that here you really get put into the community, so you end up working with the internal medicine specialists, the gynecologists, the emergency room physicians, and by the time you're done your residency, you really know how the system works here in Stratford, and you really get that continuity of care, because you may see a patient from your family practice on the internal medicine service or other services throughout the hospital. I think it also opens up comfort for communication, so the residents are able to pick up the phone and call the general surgeon, and they can put a face to that name, and in turn the surgeon knows the resident, and so they can have those discussions that you would usually have once you're out in practice. You can really take that on earlier in your training career.
Residents get a really good experience in rural medicine, knowing when to refer, when not to refer, what can be handled in the office, what needs to go to the hospital, then seeing those patients through. So you're in office one day, you have to send them to emerge, you're worried about a chest pain, say, you're seeing them the next morning on the telemetry unit and you're doing rounds on them yourself. I don't think a lot of other sites have so much of every aspect of family medicine to offer as Stratford does.